The Ghana Health Service now says more than 100,000 girls between the ages of 13 and 19 are getting pregnant on the average every year, exposing them to the serious complications of childbirth. To find how serious this problem is, I've come to the household of Kezia Hojame. She lives in a small town in the Volta region called Akoi Fetoko. At age 16, Kezia is pregnant with her second baby. Maupemo, her junior sister, is pregnant aged 14, and their mother, at 35, has just given birth to her 7th child with 4 men. Kezia, what do you want to be in future? Do you want to be a nurse or a teacher?
Doctor.
You want to be a doctor? How are you going to be a doctor? Ghana's new sexual reproductive health policy gives girls the opportunity to take on family planning services. But many in the country mistake that as a license for promiscuity. But the reality, though, is that young boys and girls keep having sex, usually unprotected. The result is this: unplanned families and vulnerable communities.
The kids of today are wayward, so they get pregnant indiscriminately. For my second girl, the boyfriend takes care of her. But for Kezia, the boy denied the pregnancy, and so she's my burden.
Amen. Evelyn Bologno is a community health nurse working in this community to help pregnant mothers and their newborn babies.
To some parents, they understand the concept, like you need to protect your girl child who is growing and you see that is sexually active, becoming active. But to others too, they do put their figures on us that we are spoiling the children. How can you be talking about family planning to a girl of 13, 14 years? Meanwhile, is that time that they become active in sex.
And the result of this is not hard to see. In the local school in Akoi Fetoko, 7 girls have dropped out of school this year alone because they became pregnant.
10 divided by 5, 2. The girls' participation in the school is low. What I realize is maybe in the community they don't have much women or girls, so it affects them. For instance, classes, we have only 3 girls in class 6. Yeah, so it means as time goes on, if we don't get a new admission, when they get to Form 3, it means we have only 3 girls that will be there. So if they are home and if they get pregnant, it's a cycle. It will also follow again. If nothing, they don't do anything and they are pregnant, they give birth, they are going to take care of their children single-handedly or struggle to take care of them. So what problems they face is going to recur.
A growing problem of teenage motherhood does not only have implications for the health of these girls, it also leaves problems of a country that has growing numbers of people with poor conditions of life. Justice Beidu, Joy News, Akoi Fetoko.
Medicine for what? Medicine for coughing. Are you coughing? Yes. Mama.
So this is the reality now. Would you allow your adolescent girl to get onto any of the contraceptives? A very difficult subject for any parent to deal with. But let me introduce to you my guests. They've been doing a lot of work on the ground. They can share the experiences with you. Diana Bona is Principal Nursing Officer, Adolescent Focal Person, Greater Accra Region. And Emmanuel Ashon is Programs Manager, Curious Minds. The girls are definitely curious. They want to experience. Good morning to you. Thank you for being here. Auntie Nana, you work a lot with some of these young girls. I think I was a bit surprised when I heard, oh, they can just walk into any facility even without their parents or their guardian and ask about family planning. How many of these young girls come to you?
Indeed, there are many, I should say, because 2015 annual record shows that about over 10,411 girls were pregnant, teenagers.
Over 10,000?
Over 10,000, 10,411, with the age ranging from 10 to 19 years. The 10 to 14 years were 189, and the remaining were 15 to 19 years. So indeed,
are these people who are having sex by themselves?
Of course, we cannot determine whether they were raped or they went in for it willingly. Some of them were actually coerced into it, if we can put it that way, and some probably were raped. But the bottom line is that there were the number of young girls who reported to our facilities. So indeed, it's a big challenge, and for that matter, we are encouraging them to come for contraceptive use, and indeed, some of them did come. Oh, I don't have the statistics now, but I think those who came for contraceptive services range over 6,000 for 2015.
For Greater Accra?
For Greater Accra alone.
Over 6,000 young girls. So these girls came
young
unaccompanied?
Young girls and boys who also came for condom use. And they came
unaccompanied?
Yes. This time the policy doesn't stretch that if a young girl is coming for contraceptive services, she has to come with a parent. No. So she can just come in. And indeed, we've also encouraged family planning services on weekends. At first, we used to work from Monday to Friday. But these days, we've encouraged family planning services or the clinics to operate on weekends as well as during the afternoons.
Okay.
So the young girls who cannot come during the day when the adults are there can come over the weekend or after working hours.
There are so many questions I want to ask you, but let me go to Emmanuel. Emmanuel, you also work on the ground. Is this a story that is familiar?
Well, I think this is just the reality. It's perhaps the tip on the iceberg. There are many stories like this that happen in our communities, and surprisingly in Accra as well. There is a tendency to believe that once in the city, you don't have such cases. But even within the city, just less than an hour drive from here, in the center of Accra, you find a lot of people in such desperate positions. But I think we need to unpack the issues. First of all, we should note that this period, the second decade of life, that period between, that transition between childhood and adulthood is marked with a lot of changes. Changes in the body, changes in the way you relate to society, and all those things.
But those changes, have they changed? I mean, we know technology has brought in a lot of things, but the feelings that you feel in your body, I'm sure for the young person who is experiencing it now, I experienced it when I was that person's age.
Absolutely. But the environment within which you grew up is not the same as the environment we have today. There are different things that interact with young people in a day. I say that you may be successful at locking your daughter, say at 7 p.m. to sleep, but you may not be successful at preventing your daughter from interacting with the world. Because if your daughter has a phone with internet on it at 7 p.m. when she stays in her room, you have no guarantee that she's not interacting with the world. But you may not perhaps have experienced that when you were her age. So there are different things that are happening. And I'm saying that we need to look at that period. It's a journey that the young people go through at that stage. If you don't guide them, they are not able to go through that. Reason that my organization, for instance, joins others in calling for comprehensive sexuality education in our various basic schools. Because we believe that if you are going on a journey and you don't know the road, it can be very discomforting.
So you are starting with basic school?
Basic school. Young people should know about that. The fact that somebody knows something, the fact that I know how to shoot, doesn't mean I'll go about shooting anybody I come across. The police are taught or trained to shoot and kill, but they don't go about just shooting anybody. So the fact that we expose young people to knowledge on their sexuality does not necessarily mean we are promoting promiscuity. They need to know about the changes that occur in their lives. And remember that when you take young people through comprehensive sexuality education, it exposes them to a wide range of options. One is also about abstaining from sex. And when we talk about contraceptions, people have the tendency to believe that, oh, you are promoting promiscuity.
License to go and have sex.
Abstinence is also a contraceptive. Contraceptive is basically preventing pregnancy from occurring. How do you prevent pregnancy from occurring? You can abstain from sex. It is one of the ways. So if we expose young people to this wide range of knowledge on their sexuality, how their bodies change, the feelings they have, letting them know that some of these things are normal, you can deal with it in these ways and all that, I think it will help them navigate this road.
Sure. So, Auntie Dinah, are our young children having sex more now, or is because we now have data?
I think probably they are having sex more. Why am I saying this? Now there's internet, and you would agree with me that if you watch certain films, even you an adult, you find yourself in certain mood where you can easily become trapped to have sex. But hitherto, there was nothing like internet, or probably in Ghana, if I can put it that way, or mobile phones were not available. So it was much difficult to come into contact with that. And now also more young girls are also attending school than it used to be. So even upon the education that we've been giving to them on abstinence, prevention of pregnancy, either through contraceptive use or abstinence, but they still find a way of satisfying themselves. There's a popular term in the school that tree, I don't know if it's Ga or whatever language, tree, but what they do basically is that the guy fondles the girl. And you can imagine what will happen if they are hiding in a dark place, a corner, just the two of them, and the guy fondles the girl and tells her that we are not supposed to have sex, but this is just a way of satisfying ourselves. What will happen? They will end up by indulging in it. So probably we are alarmed because of the way people are more enlightened, because they have access to certain things which can expose them more.
Okay. So there's a question of what are we not doing right, either as parents, as guardians, and as a society. But let me read a message that came in earlier from Krobia in Offenso. Krobia says, good morning to you, Mama V and Roland. The issue of teenage pregnancy is very serious. For example, where I teach, lack of parental guidance is a major factor, because the parents do not care whether their wards sleep at home or not. So it's about time some parents take into consideration the well-being of their wards. And that's from Krobia in Offenso. And I'm sure some people are thinking, how can I not care whether my child is sleeping at home or not? But what is the problem? Where do you see, we've identified by, yes, young girls are having sex more. Yeah. We've established that. But what are we not doing right?
I think as parents, most parents are not even aware of what is going on. Most parents never had any education on how to prevent pregnancy when they were younger, or any education on sex. They just found themselves indulging in it, whether they were married or not. So such a parent most of the times wouldn't talk about sex to the child. But you know, if you don't do this and the child tends to explore by her own, then she can find herself pregnant. Again, you go to schools, and when you want to talk about contraceptive services or family planning, the next you are branded as a sinner. So you give all the talks and conclude by leaving your number with them, so that those who want to follow up with for services, they can come into contact with you. some parents don't even want to hear about contraceptives when you are educating the children in school. So all these things are actually compounding the issue of the message not being able to actually go down very well, even though we are doing our best. So I think it's the responsibility of parents, the media, the Ghana Health Service workers, the clergy, indeed everybody.
So we should be preaching the message of contraceptives.
I wouldn't say only contraceptive, but first and foremost abstinence, because
but clearly that isn't working, because that would be the message from every parent. Don't have sex. Stay away from sex.
Yes.
So if girls are still getting pregnant, then it means that message is not. It's not going down.
But we shouldn't be discouraged. We should still talk about the abstinence, because indeed contraception can also fail us. It has a minimal percentage of failure. So we would rather advocate for abstinence.
So these girls that come, what are they using more? What kind of contraceptive are they using more?
They use the condom. The condom.
Is it the female condom? Because I know that even
we have the female condom. Yes, they use the female condom as well as the male condom too. And some also opt for the implants. The implants protects for about 5 years. So the implant is also popular. And the injectables too. Because the injectable, she just walks in for the shot and she's gone.
So does she tell somebody else that what she's on, or this is a private matter between?
Mostly it's a private matter. They just walk in and come for it. But there was a very funny incident that happened in one of the facilities outside Accra, by one of the rural part of Accra. A young girl was brought to the facility for implant. An implant is normally implanted on the upper arm. So when the girl left the facility, she just went straight to the school and informed her peers that the mother took her to the family planning clinic and the nurse inserted an implant on her hand. Unfortunately for the nurse, when she was going home, I think she lives somewhere closer to the school. So the girl pinpointed the nurse that this is the nurse who inserted the implant on my upper arm. So all the children saw this nurse, and she was branded as the nurse who keeps on inserting implant on on young girls' arms. So indeed, it's not.
But what kind of? Maybe I should come to you, Emmanuel. Then I answer that, and I'll come to you with, say, I'm a young girl, and then I come to you. What would you typically ask me? And Emmanuel, let me ask you the same question of who is failing these young girls?
I think that society is failing. This is a joint responsibility. You cannot blame government alone. You cannot blame parents alone. I think that we all have a fair share of the blame. But I think we need to also look at the issue holistically. There are some underlying issues that we are overlooking. When you talk about teenage pregnancy, then it means the child has had sex. And we are looking at a period between age 10 to 19 years. Many of them fall under the age for sexual consent. And you need to be 16 to give consent to sex. And so one of the questions we should be asking ourselves is that who impregnated that girl? Because there are criminal elements that we also need to deal with as a people. And so we should be interested.
I've had that conversation with a woman who is in charge of the girls' units of the Ghana Education Service. And I think she was calling for stiffer punishment for the boys.
Exactly. Not necessarily the boys. So, for instance, if two young people under 16 have had sex, clearly per the law, they have some kind of, if you like, freedom, because per the law, they did not know, to use the word loosely, what they were doing. But if the person is below 16 and the other person who had sex with her is above that age, then that person has taken advantage of the minor, as they are called, at that age. So it is something that we also need to look at the criminal element. We also need to look at what are the underlying factors that push these young girls into getting pregnant at that age. The primary aim for many girls in using contraceptives is to prevent pregnancy. But we should also be looking at issues like sexually transmitted infections. Not all contraceptives protect against STIs.
In fact, most of them do not.
It's only condom, male and female condoms, that has dual protection for pregnancy, to prevent pregnancy and also sexually transmitted infections. We should be interested in that as well.
Okay.
So that we also don't look at this just as teenage pregnancy. This is also a chain of problems. So a girl gets pregnant, which was unintended and unwanted. There are some pregnancies that are unintended but wanted. But in these cases, most of them, they are unintended and unwanted. It leads to something else. This girl is anxious and all that. She wants to abort the pregnancy. Most often, they are not able to afford assessing comprehensive abortion care. So they would want to go through the illegal means, go and take some concoction and all that. That leads to something else. It leads to a complication and all that. There is a chain of problems that they go through. And I think we need to look at this problem holistically, not just focus on one small bit about teenage pregnancies. Why are the children getting pregnant and all that? But if we have that holistic approach to this issue, I think we will be able to deal with it. We shouldn't just look at government, we shouldn't just look at parents, but as in people, we need to look at, I think we have a very good policy environment around this. We have the adolescent sexual reproductive health policy, which basically gives guidance on these things. But beyond that, we should be able to mobilize.
Maybe it's just hidden on a book, so a lot of people are not exposed to the content of it. But the conversation is also very much on Facebook. I'm not cutting you, Emmanuel. I'll come back to you. Let's see what people are saying on Facebook, because we post the issue on Facebook. Lots of comments. Mohammed says it is not about giving teenagers contraceptives, but they only need thorough education as in when to start having sex. Arnold says they need education beyond the school, more recreational centers to engage both sex. At this age, sex is easier to think of when you are idle. Ismail Isaka says advice doesn't work, but I think they should be educated more, because if you give them you encourage them to practice it more. Evelyn Yabwa says, my little opinion is to tell them directly the repercussions after indulging into unprotected premature sex. Tell them in the face the consequences and challenges of such act. Cosmos says, Cosmos says, no, they shouldn't be given contraceptives, because the question that we're asking is, would you give the young adolescents contraceptives, considering the fact that they're still having sex and a lot of them are getting pregnant? So Cosmos says they should be taught with the word of God and also be educated on sexual issues. Jason Ninoy Note says no, they should be taught about self-love, self-respect, and the wider implications and issues surrounding sex. A mentally and emotionally strong woman is less likely to get impregnated by a waste man. Idrisu says no, I think our leaders has lost their minds. Our systems of education is killing us slowly, because we forget of the backbone of our society, which is religious and moral education. Winnie Dramani Tanko says parents should give teenagers good parental care rather than give them contraceptions or contraceptives. I think that is the only solution to this problem. So Ohene says men should be given contraceptives too, not females only. And Afo says yes, because no advice will change them, because they need to protect themselves. And I'll end with Nicole, because we've got lots of them. Nicole says, wow, I had no clue. Is the family structure in Ghana just as bad as it is here in the US? Well, the world is a global village. It doesn't matter if you live in Ghana, if you live in America, wherever in America. I mean, we're all the same. What we're exposed to everywhere is the same. Conversation is also on WhatsApp, 0560-800-1000. And I see we're, engaged or engrossed in this conversation. Sex is actually part of the private subjects they study in their respective schools. That's Frank in Kibi saying that. And ahead of that, he says, The root cause of teenage pregnancy, and with reference to a common documentary, is simply about poverty. Sex education should be intensified, and sincerely, I wouldn't hesitate at all to introduce my adolescent daughter to contraceptives. I'm a teacher at the SHS level, and I know what I'm talking about. Frank and Kibi. And that's a frank opinion coming from you, Frank. Would you give your teenage adolescent, your teenager, contraceptives? Would you introduce them to it? I asked Auntie Diana, what would you say to me? Say I'm 12 years and I've come to the facility alone.
I would introduce you to contraceptives. I would do that gladly.
Okay, are you going to ask me whether I'm sexually active and why I want to do this?
Once you have come, I know you are sexually active, but I wouldn't just straight go ahead and just give it to you. I will have to counsel you first.
Okay. I
will take you through counseling, give you the options, and then you opt for what you want.
Yes. I know that one of the reasons, maybe in a place like Accra, because it's big, you can come from a Showman to maybe a Dabraka and then, you know, seek for some kind of help like that. But in places where everybody knows
somebody,
the young girls are not encouraged. What kind of, are you trained to keep your mouth shut irrespective of whoever comes to you to seek for help?
That's the issue of confidentiality. And confidentiality and privacy is really the most important, one of the most important aspects when we are rendering services. So every service provider is told about how important confidentiality is, and for that matter, they ensure that whatever conversation that goes between they and a client doesn't extend beyond that. If there's the need to extend it to the third person, a permission is sought from the client.
So as a parent, can I come to you and ask what my daughter had come to do with you? Would you disclose what
I wouldn't disclose it to her, to you.
So it's strictly between the young girl and you?
Absolutely.
Okay. Emmanuel, is that encouraging? I mean, would that when you do the education, do you tell the girls that we have a policy that allows you on your own, without your parents' advice or their consent, to do this?
Well, what we do is to provide comprehensive sexuality education. This is basically to say that between this age bracket, these are the changes that occur. The young people are taken through subjects like HIV and AIDS, sexually transmitted infections, and contraception and all this. They are also told about services that are available to them, and that when you go for sex services, like Auntie Dinah said, you are assured of confidentiality, you are assured of privacy, and all those. So we give those young people basic information about this. But I think there is one very important point that has to be made. Contraceptives should not be taken out of context. It should be part of comprehensive sexuality education. Let the young people decide for themselves whether they want to have sex or not.
But the young people are 10, 12, 15-year-olds.
Yeah, but I'm not even saying that they should go and have sex. What I'm saying is that they should decide for them. What you do is to expose them to the information. Let them know that these are the consequences of having unprotected sex. These are the consequences of even having sex at this age and all that. Let them be exposed to the wide range of options available to them. They need to take their own decisions or make their own choices based on the information available. But the lack of information alone does not mean that young people would not have sex. Young people are still having sex anyway, whether you tell them or not, because they are exposed to other forms of or other sources of information. So it is rather better that you give them the right information, let them know what is available, so that they make the choices whether to abstain or to have sex. And if they want to have sex, it has to be a safe sex. Safe sex means that you should have protection.
So at what age, then this is the personal question, at what age would you introduce your your young children to contraceptives or start the sex talk?
For me, I hesitate in mentioning age in particular because it depends on the maturity of the person.
Let me put it this way. What kind of signs would you be looking out for before you start the sex talk?
Immediately, the young person begins to give you some signals. They are always pointers. They are watching a movie, they behave in a certain way when they see perhaps a romantic scene or a sex scene. There are various pointers that occur. We also need to structure our curriculum in such a way that we provide what they call age-appropriate sexuality education, so that when you look at the adolescent bracket, you categorize them into young adolescents, those who are in the middle bracket, and the late adolescents, so that you provide them information that is in consonance with their age and maturity.
All right.
So these are things that you look out for, but I cannot say that start at age 9 or start at age 8. At any point in time that you begin to see signs of this person getting exposed, you gradually walk them through and all that. So we are not just waking up and telling them, use contraceptives, or I'm giving you condoms, go and use them, but provide the right information, and there should be that enabling environment there. Because the fact that you teach somebody about contraceptives doesn't necessarily mean the person will use it. Because you need to look at access to contraceptives. There are places in this country, in the documentary that Justice did, there are places in this country where they would not get contraceptives. There are some places they may even get the contraceptives, but because of some barriers, perhaps the service provider...
I was going to say that it comes with the costs.
Yes.
So what do you do with these young people? Or they come, prepared?
Some come prepared, others don't, but those who don't come prepared, sometimes they are offered freely. Because they are not very expensive. They are not expensive, so they are offered freely. The cost actually is not a barrier for us per se, but probably the cost of transportation from wherever the person lives to the facility is much more of a challenge than the cost of the contraceptive.
So I'm just thinking, just occurred to me, that when the young girls come, would it be out of place to want to see the boyfriends, to do the education together with the boyfriends?
No. No, we don't.
Let me read something. I still can. I mean, no matter how many times I deal with this subject, whichever angle I don't know, because I will get there. But this person says, good morning, Mama. Curiosity used to be the cause of teenage pregnancy in the past. Most parents still feel sex education at home is a taboo. We need parents to come on board as well to help reduce teenage pregnancy and STIs rate in the country. And that's from Debbie in Kumasi. This one says, I think it's time parents stop living in the past and deal with issues that is happening now. We're now in the 21st century, and both girls and boys should be talked to about their sexuality and tell them the consequences. I believe in the contraceptive course. There's a lot of shorthand, and I find it very difficult, but I think I get the import of your message. Thank you very much. Kindly include your name when you send me a message. This one says, in my school, 9 girls are pregnant. 1 managed to abort her own. Amazing. This one says sometimes it's financial problem and having bad friends, especially the girls having big eye, want to get everything that their friends have. This one says, this is Prince Amwating Kabuni from Oforikrom, and Prince says, Doctor, you're talking on Dr. Wampa. We're talking teenage pregnancy, sex and contraceptives. Is the principal saying it's good for 13 to 18 or above young girls to use contraception like injectable or implants? Edwin in Takrady is asking you. Okay, but let me read this and then maybe you can box it. I don't think teenage girls should be given contraceptives. Rather, the laws must work that if anybody sleeps with a minor, he should be jailed from, and that's from Nyantichi Ras. I sending the message. It's a very difficult subject. I said it for parents. Very difficult decision. And I think even realizing that your young children are engaged in this, it's very scary. But Charlie, this is it. You have to face it. This one says, I think the root cause of this problem is education, and it should cut across. Parents should be the number one to be taught to live up to the age in which we aside education the youth, monitoring the youth should be done with love. And that's from Mac. Thanks, Mac. Elviro says, I would say yes, if only they can be given to them without their notice, like injecting it to them when they are unconscious, so they wouldn't know. And after that, oh, please don't WhatsApp call me, I beg you. It's just for text. Okay. Injecting it to them when they are unconscious so they wouldn't know, and after that they should be taken through sex education. And that's a parent who doesn't want to know. I don't think they should be given. All they need is serious moral lessons. This one says, this one says, good morning to you and your guest out there. Good morning to you for watching, and kindly don't call my WhatsApp number, otherwise you distract my reading of the messages. This one says privacy and confidentiality is the key. Martina said before that is a big yes. Adolescent girls should be given contraceptives. It prevents them from getting pregnant to drop out of from school. At this stage, they are sexually active. Some get pregnant and become a burden on people. They do a lot of things that you, Mama, we don't know. I agree. Good work you're doing. And good morning, Martina. Yeah, they're doing a lot of things. We don't even want to begin to imagine. But we have to end this conversation. You are on the ground. You get practical with these young girls. And box it, if you may, with the question that Edwin from Takrady asked. Is it safe for these little girls to be using all these contraceptives? What would you say parent should do? I mean, how do you even begin the conversation with these young girls?
Okay. It's safe they can use contraceptives. Considering or comparing contraceptive usage to abortion, I mean, which one would Edwin opt for? His daughter to go through? Is it the abortion? And I think I began by saying that we talk to them about abstinence. Where the child cannot abstain and she's bold enough to come to us for contraception, I think it's important we deliver that services. Again, parents can also start talking to their children about sex. As my colleague said, immediately they see some pointers. If you are watching a program with your child and she or he asks you certain questions concerning sex, you have to just deliver the message to him or her. Yes, but you wouldn't tell him to go in for sex. No, you will have a way of packaging it to the child. Having it at the back of your mind, the age of that particular child is also very important. You can just simplify it in one sentence.
Okay. Ebenezer, I don't know if you have, Emmanuel, I don't know if you have any daughters or children yet.
No, I don't.
Okay. So how do the schools even open up for you to come in and have the education?
Yes, schools do that. Unfortunately, the one restriction that we have with schools is, for instance, condom demonstrations. Basic schools do not allow for that. I think that it is something that they perhaps need to revise, because truth is that young people are having sex. The evidence abound on our streets. Are there children who report to our clinics? When you look at the statistics, out of the number of people who give birth in a year, what percentage are children, or what percentage are within the adolescent bracket? The evidence is there for us. We need to deal with these issues. And I think that it's about time we face the hard facts of these issues. We shouldn't see people who want to provide information to young people as those who are promoting promiscuity, but rather as people who are seeking to help society so that we'll have a quality population. I think that is the underlying factor. We need to have a quality population. People should come into this world because they were planned for, not because they came by mistake. And so pregnancies should be well intended, planned for, and expected. And when these children come, they should be given the proper nurturing. But you can't have a situation where somebody wakes up and suddenly feels a strange feeling or has a strange feeling, and it is pregnancy. They go through that trauma, torture, and all those things. We can't continue to see our young people go through this. Let us act as a people.
All right. We have to end our conversation here, but don't end it in your homes, your offices, or wherever you're watching us. If you're following through on the internet as well, because we're streaming live, don't end the conversation. Let's carry us through and let's spread the message. Teenage pregnancy has gone viral now everywhere. Maybe not, but here at here at my place in Kumasi, dear, easy. Oh, Charlie. That's from Arab Prince Didat, who sent an earlier message that some years ago at this time I was busy learning something. I'm not sure it can be possible. Can be a possible question. I want to thank God for how far He's brought us all. I wish all WASSCE candidates good luck and success in their examinations. Okay, so this is where we have to end the conversation. There are more messages that you're sending us, but we obviously cannot share everything. But I want to say thank you to Auntie Diana and Emmanuel for your time and for sharing. All right, stay with us. You're watching the AM show, and AM Talk is right after this.